All right. Well, good morning, everybody. Welcome. It's a great day, and this is the Chickmaster Tech Tuesday webinar series. My name is Stephanie Cooper. I'm the marketing manager here for Chickmaster, and I'm so honored that everybody could join us today for our topic, which is the chick breakout analysis. If you have any questions during the presentation, please use the Q&A button at the bottom of your screen, and we will address those questions throughout the presentation. Our presenter today is Chad Daniels. Chad is our hatchery specialist manager and has been with Chickmaster for 12 years. Chad has been in the industry, however, for 32 years and is a wealth of knowledge about incubation and embryology. So welcome again, and without any further ado, I would like to give you Chad Daniels. And I guess, Chad, are you there?
Yes, there we are.
Great.
Good morning, everyone. Thank you for joining us today. We've got a great topic. I hope it brings up lots of questions, and hope I can answer a lot of them. So anyway, with no further ado, I'll get started. In the content of this presentation, we're going to talk in the beginning about an introduction to residue breakout, and we're going to talk about embryo development, and then we're also going to discuss some common problems that we run into when performing a residue breakout or having a successful residue breakout procedures. So to begin with, what is a residue breakout? We know that we transfer eggs out of an incubator into a hatcher basket, and from that, a percent of these eggs will hatch. Out of that, we'll have viable chicks that will be obviously placed into a broiler house or whatever your situation is, and in addition to that, we'll have some non-viable chicks, or in other words, a cull chick. What remains in the basket is what we refer to as the residue, which are eggshells from the hatched chicks, and then unhatched eggs that were either infertile or they were fertile, but the embryo died at a specific day of age. So by completing a breakout or performing a residue breakout, what it allows us to do is to analyze and document, which helps us identify why the remaining eggs did not produce a viable chick. So to begin with, in order to develop a good residue breakout procedures and be successful in your own hatchery, you kind of first have to start with defining what you need from your residue breakout program. As most of you know, I travel exclusively and visit a lot of facilities, and a lot of times I'll see hatcheries that do a residue breakout simply from the name of determining what the fertility of individual flocks are. And that's it, simply in the name of providing a breeder department or a breeder manager with data in order to better manage farms. To take it a step farther, now that we have that fertility and we know what our actual hatch is, you could also utilize the residue breakout data to help determine what your hatch of fertile is, which is more of a true means of measuring performance in a hatchery. Once the residue is completed and we want to take things a little farther, we can use it to verify our hatch percent. So if I complete a residue breakout, it'll provide me a residue hatch percent, and I can just compare that to my actual. It also lets us do incubator and hatcher troubleshooting. So if I'm having a problem with performance from a hatchability standpoint, by doing the residue breakout, I can help determine whether that is incubator or hatcher or maybe another issue. And then if I have a complete program in operation, it allows a complete analysis along with data entry and trending reports, things that occur for life of flock or for maybe the different seasons of a year for a hatchery, which oftentimes affect ventilation and affect incubation performance. And so by developing a good procedures and determining what you want from your program helps you decide in the beginning how to develop your procedures. So when we talk about procedures, one of the first things that I generally recommend to a hatchery is first identify who's going to be performing the residue breakout. I always believe it's critical to have a couple of people trained. I believe that having a hatchery manager involved, either to do the residue periodically or to at least observe it on a regular basis, is also important. I've seen a lot of companies be very successful by getting their breeder managers and breeder techs, or companies that are responsible for providing eggs to the hatchery, to also be involved with the breakout periodically in order to review or see some of the things that you see during the breakout. And then obviously, I think it's important to periodically get outside technical support in various forms, whether it be from your primary breeder service company or your incubation manufacturer. And then I think it's important to visit other, local hatcheries to see how they do things, and may help you determine a different way that you put together your procedures. So once I've made that determination, generally next for the program is identify which flocks are going to be in the program, what egg source is going to be picked or determined to be a part of your residue breakout. For me, I generally recommend every flock for total fertility. And as I've pointed out here, some programs or some hatcheries only include flocks that aren't hatching at standard. So it's pretty common to see hatcheries that may have 30 source flocks, and they may only break out 4 or 5 of those because they're flocks that are not hatching to what is considered standard. Number 3 on our procedures list is to identify how often those flocks will need to be sampled. For me, I generally recommend at least every flock every 2 weeks, and that gives you enough data to at least build a trend line, because you'll see the fertility change. You'll see hatch of fertile change as a flock comes into production, reaches peak, past peak, and then once it gets becomes an older flock, it helps with the trending for those flocks. In addition, what's important also is to determine sample size or the number of baskets to represent each flock. I generally recommend a minimum of 3 baskets per hatcher or per flock house. And I say flock house because it's fairly common for certain regions to have multiple houses on a farm, and a lot of times 3 baskets from one farm may only be 3 baskets from one house of a 3-house farm, and it won't give you good data. So I always try to make sure I do a minimum of 3 baskets per house. Keep in mind that flock age affects rate of production. So a 3-tray sample may not be enough for good data on a prime age flock. So if I have a house that's a bigger house with prime age hens versus a smaller house that's an older flock where I've had a lot of hen mortality and production is lower, a 3-tray sample may not be necessary for the old farm, but a 3-tray sample out of a big house prime farm may not be a good representing sample. So it's good to make sure you keep that in mind when you're determining your sample size. So depending on your needs, determine the best baskets. So this begins with basket position. I always generally recommend making sure that on a base program, I choose an upper, middle, and lower out of a hatcher machine for each analysis. And this lets me see things from various places out of the incubator, oftentimes upper, middle, and lower out of the incubator as well. Be aware of how the eggs are transferred to determine where they were located in the incubator and tag accordingly. And this is important as well when you're determining what baskets you want to use. And then what's very common in places with Anovo is canneling off of the Anovo machine, or oftentimes just a canneling program where anything that candles clear, such as an infertile or an early dead, is removed. And it's important to always remember that during your breakout, because if you want a true analysis, you either need to break those out when they were candled and removed, so you know what your fertility and what % early deads you have, or leave those in the tray and break those out once you've pulled all the chicks out. The identified hatcher baskets, and this is recommended, should always be tagged accordingly with a hatcher number, a flock number, and a position of that basket. I always recommend making tags ahead of time, and I'll use commonly the small tags with the wire or with a zip tie on them that I can just put on the basket, and that way I can document everything prior to putting it on the basket. So really, during pool, the operator should take the tagged basket and remove the good chicks by hand, leaving only the residue and any easily identified cull chicks in the basket. So saving the entire basket ensures that the identified tags aren't swapped, and the amount of marconium or fecal content can help determine how long the chicks have been out. So this lets whoever is doing the residue breakout add that as part of an analysis. When I look at that as a sample, the picture here in the bottom left of your screen kind of helps you look at a pip line, which kind of gives you a little bit of a quick visual check to determine how much moisture loss. It's not going to let you say exactly what your moisture loss is, but it's going to tell you whether you have a pretty decent pip line or not, whether it's pretty close to the equator, or maybe if you have very poor moisture loss, it may be very high on the shell. You'll also notice in the picture on the right-hand side of the screen, this is an entire basket that was saved minus the viable chicks. And you get a pretty good visualization there that the chicks in this particular basket probably pipped out fairly early because of the amount of marconium or the marking on the shell. And so this represents that possibility that maybe those chicks could be slightly dehydrated. If this coloring is maybe a little bit worse, it may also show signs that chicks were overheated in a hatcher machine just prior to pool. So I always think it's important to try to keep an entire basket in order to make those additional observations. I'll also commonly pick up these eggshells and crumble them in my hand, and if they crumble easily, the membrane crumbles easily, that also is an identification that maybe there's a hatcher machine that was extremely dry or very dry, or the chicks were just out for an extended period of time prior to pool. So now that I've worked through some of the procedures, one of the most important pieces of having a good breakout program is to have a good residue breakout sheet. And it's simply nothing more than a sheet that you want to document the information that you're looking for. I've seen probably hundreds of sample sheets in my career. This just happens to be one that I commonly use. If I go into a hatchery and they don't do residue breakouts, I'll pull out, or I'll use this sheet. Or if I look at their sheet and it's really not going to give me the type of information that I'm looking for, then I'll generally use this sheet. But the important thing is develop your sheet to give you the information that you want, the things that you're looking for. In this particular sheet, I'll point out a couple of things. For my procedures, when I take a hatcher basket and I've removed all the viable chicks and I now have only the residue, I will make sure that every egg that is unhatched or every cull chick that is in that basket, I document in the top portion of this sheet. And I developed this sheet to allow up to a 4-tray sample. Obviously, you could develop your own sheet to just be 3, or maybe up to 6 or 8 or 9 even. It's entirely up to you when you develop your own sheet. But the goal with this is to make sure that every sample that comes out of that tray or that basket goes in this top section. And realistically, all I'm trying to accomplish here is determine the infertiles, the day of embryonic death, or whether it was a cull chick, And that allows me to look at totals from a percentage standpoint. So I know what my percent of infertiles are. I know what my percent of 15 to 18 or 19 to 21s are, or I can total those and just call them late deads if I choose. What you'll notice on this sheet is something that is supplemental data, as I refer to it. And the purpose with this is, while every egg is documented in the top portion, any supplemental data that I can put in the bottom just helps me continue forward with some troubleshooting. And I think that's very important in anyone's residue breakout sheet, because it lets you make decisions that will improve your performance. So before we get our next step, we're going to discuss some embryo development, and that way we can help identify a day of embryonic death.
Great first part there, Chad. Yep, keep going.
Okay. So let's talk about our day one development in the incubator. With day one development, we know that we have appearance of tissue development. When you look at the picture here, you see that the germinal disc in this illustration shows development and has a uniformity to it, oftentimes referred to as a donut shape. This oftentimes helps us recognize the difference between an infertile or a fertile. Very commonly, once you've made an egg set, a lot of times I'll go to an incubator after 24 hours of incubation, and you can pull out an egg sample and look at the size of the germinal disc and development, tissue development, and it kind of gives you an idea of how far along that those eggs are. A lot of times that may be a little bit bigger or a little bit smaller, depending on warm up time and things of that nature. You'll see other pictures such as an egg with non-uniformity around the blastodisc, meaning it probably wasn't fertile. And you'll commonly see a lot of modeling. Sometimes this is water that has migrated into the yolk and caused some discoloration. But I want to play a short video here, and it'll show some of the development that is occurring. And so that's our day one development. When we look at day two development, the heart and blood vessels begin to appear. In some cases, you won't see a lot of blood until the very late part of day two, at least visibly with the eye. But under a microscope, you can see the blood or the vascular systems developing pretty quickly. Also continued tissue development. You can see in our picture or illustration there, you can see slight amounts of blood. So as we continue on to day three, we recognize that the blood vessels now are very visible, and that the tail buds. As we work into day four, limb development begins, wing and leg buds. The eye is pigmented and the brain appears. In day five, limb development continues, appearance of elbows and the knees. Day six, digits form, beak development begins, and then of course you start to have voluntary movement also begins. You can see in these pictures on the right hand side of the screen, this is this was poured into a petri dish, so it's relatively small, but it does give you some size with the scaling on the bottom there. You can see the actual size of the embryo. Once we get into day 7, the beak development continues. The egg tooth actually begins to appear, and then the comb growth begins. We're day 8, feather development begins. Feather tracks are seen. Upper and lower beak equal in length. Generally for me during a residue breakout, I'll have a tendency with these smaller embryos like this to really dig into them a little bit and look for some of those feather tracks, because that helps identify, am I past my early stage, or am I now entering what I would consider a mid dead. Day 9, the embryo starts to look bird-like, and then the mouth opening appears. Day 10, by this point, the egg tooth is generally pretty prominent, but then you also start to see claw development. There we go. Day 11, the comb becomes serrated, and you'll start to see the tail feathers will be very apparent at this stage. By day 12, we've got scales that will form on the feet and the legs. The toes should be fully formed at this time. First few visible feathers, and then the cam or the chorioallantois membrane should be totally formed by this time. You can see that in the illustration. Now we're getting into more towards the beginning portion of what's where we begin to identify more of a late stage type embryo. So we're nearing the end of what's classed generally as mid dead, but more into starting late deads. You'll see that eyelids form, and then the body's covered lightly with feathers. You'll also recognize in this picture in the bottom right hand corner with day 13 that the embryo growth has really grown. The embryo has grown quite a bit just in those last couple of days. By day 14, the embryo positions its head more towards the large end of the egg. Day 15, the embryo will begin to draw the gut into the abdomen cavity, and therefore there'll be less exposure of that, which kind of gives you a little bit of an identifying mark to make that determination that it's now into late stage. By day 16, feathers completely cover the body, and then the albumin is also nearly gone. Day 17, we'll notice generally that the head is now tucked between the legs, and the amniotic fluid will decrease. And by day 18, the growth of the embryo now is nearly complete. The embryo will position its head under the right wing, or begin to position it under the right wing, and then the embryo will begin to absorb the yolk sac. You see in the picture there are quite a bit of the yolk that in this picture is still on the outside of the body. Day 19, the yolk sac generally finishes it being drawn into the abdomen. The amniotic fluid is now gone, and the embryo occupies most of the space within the egg. Yet it's not in the air cell yet, but it does occupy most of the space within the egg. Once we get into day 20, the embryo will internally pip and become a chick breathing in the air cell, and then following that, external pipping will begin. And then, of course, day 21, it finishes pipping and eventually becomes a baby chick in the tray. So the importance of understanding embryonic development and the various stages goes back to the development of your residue breakout sheet and you making determinations of what day that the embryo died. And this is important because it helps you make determinations of troubleshooting and make a choice for where to go look in order to try to fix your problem. So we recognize that we have an infertile, and then obviously we generally document a 1 to 3 day category, generally because this identifies that it is fertile, up to a 3 day of development, which is very visible due to the development of the vascular system. You'll see a 4 to 7 when it's pretty easy to recognize that the pigmentation of the eye is there, oftentimes referred to as a black eye. It's still a very small embryo at this particular stage. 8 to 14, obviously you have the pip tooth. You've also got the feathers covering the body. It's more bird-like at this stage, and there's a tremendous amount of growth that occurs during this time period. 15 to 18, pretty recognizable when you look at the size of the embryo and recognize that really at the end of 18, it's just starting to absorb that yolk sac. So there's still quite a bit of yolk that's outside of the body. And then 19, 21, you'll see more of the yolk sac that has been absorbed. There'll still be a little bit present, as you see in this picture. And then, of course, another common thing you'll see in hatch baskets at breakout are things such as cracked eggs or contamination, things of that nature. You'll see the contaminated egg look very similar to that. Doesn't smell very well either. Anyway, so breaking down your residue breakout sheet into categories, a lot of hatcheries do an infertile, an early, middle, and late, and that's generally very common to see just those 4 categories. I generally like to break down the late stage into a 15 to 18 or a 19 to 21 to try to help determine if it was an incubator related issue or a hatchery related issue. So now that we've talked about embryo development and identifying day of embryonic death, let's talk about some common problems that I run into when we visit hatcheries in regards to having residue breakout that they're successful with.
This is all awesome, Chad. Thank you so much. So again, just for our participants, if anybody has a question, feel free to use that Q&A button at the bottom of the presentation. And we will either answer that here, we'll ask Chad that live during our presentation, or we can also answer that offline as well.
So when we see some common problems, the sample size is too small for accurate data. This is generally probably the #1 common problem with trying to develop a good residue breakout program. And what we'll see, obviously, is that hatcheries will just use maybe 1 or 2 trays, as opposed to looking at a minimum of a 3-tray sample. Also keep in mind that if you have a specific issue, and let's say it's incubator related, and you have a large multi-zone, say single stage type incubator, it's really important to try to make sure you get samples from various places out of that incubator, regardless of where they are in a hatcher machine. So, but one of the very common problems is that the sample size is just too small. If I've got a large house with a large number of hens at peak production, it's not a very big sample size if I'm only looking at a couple of trays from that entire farm. So the sample baskets, another common problem is that they come from the wrong place. Like we talked about, always get trays that represent where the problem is at. If it's an incubator issue, get baskets that represent various places there, regardless of where they are in the hatcher. Another problem is samples only taken from one house on a multi-house farm. And that's pretty common, especially here in the States. I recognize that a lot of growers today are at least 2-house farms. In some cases, they're 3 or 4-house farms. And you'll see a residue breakout program that only gets a sample from one of the houses. And it doesn't always represent data from the entire farm. Samples not tagged correctly. This is a very common theme when you go to hatcheries. And the name that, I spoke earlier of a recommendation of tagging the basket and saving the entire basket, not just in the name of being able to look at marconium on the shell or pip lines or shell dryness and things of that nature, but also to just help make sure that I don't get my tags messed up or my flocks or a hatcher machine not identified correctly. It's pretty common to see a hatchery take the residue basket and basically just remove nothing but unhatched eggs. And first off, it's kind of hard to find them in a basket when they're full of chicks. But the second piece of that is if you have any cull chicks that are dead or down in the basket for whatever reason, generally it's very impossible to find those. And so therefore you lose that data. So it's very common to run into that as an issue once the eggs are removed and put into an egg flat, or say a cardboard egg flat, or into another type of container just for the residue breakout, and then the tags don't get transferred correctly. And so you just end up with bad data. Utilization of bad or inaccurate data. Now, what I mean by that is each sample should be verified by comparing residue hatch to actual hatch. So what I mean by that, and I'll show you a sample of that shortly, but what I mean by that is once I do a residue breakout, I have enough information simply because I have a total count on how many remaining eggs were there that did not turn into a viable chick, and I can simply calculate what is referred to as residue hatch. And my residue hatch should fairly closely, within a couple of percent, match what the actual hatch from that flock is. And so I want to make sure that I always compare that and pull out or try to understand maybe why a sample was not a good sample if my actual and residue don't match. Breakout sheet not detailed enough to allow troubleshooting. Like we talked about earlier with the breakout sheet, remember your needs. If you're going to troubleshoot, you have to document more than just infertile, early, middle, and late. Also, documenting additional information about late stage embryos is critical when trying to determine if the problem occurred in the incubator, hatcher, or during the transfer process. So it's very common to go to hatcheries and see a breakout sheet, and they're not really documenting any of that additional information. And it makes it very difficult to try to help them troubleshoot or fix problems. And also not identifying what's a very common additional piece around late stage embryo death is malpositions or anomalies. So when we look at this sheet, again, just in reference, when I look at late stage embryonic mortality, what I generally recognize is that there's a lot that goes on during this stage. It's in the late stages of the incubator from 15 to 18 and oftentimes even over into 19. It also, embryonic death in that 19 to 21 and the cold chick category can identify situations where hatcher machines aren't running maybe as well as they should, either lack of air or lack of temperature control, things of that nature. And so we also recognize that the chick goes through a lot during this stage in positioning itself. It deals with a transfer process where we are handling the embryo while it's trying to position and pip and things of that nature. So there's a lot that goes on during the late stages that can cause or drive embryonic mortality. So what I always try to do when I compare additional information, I'm looking at these subcategories. And what's very common for me is I always have a tendency in the development of this sheet, I looked at it from this perspective, is if I pick up an egg, and let's just say it does have a pipped chick, and it's a 19 to 21, pretty much all of its yolk is absorbed, and again, it has pip, yet it did not hatch and did not become a viable chick. The first thing I'm going to do is I'm going to drop down to my subcategories now. After I documented it as a 19 to 21, I'm going to drop down to these subcategories, and I'm going to start on the left-hand side of the screen, and I'm going to work my way to the right. And the first question I'm going to ask myself is, did this embryo die as a byproduct of a transfer crack, as you see here in this category? If it is a transfer crack, then I document it as that, and then I'm done. I've finished. I've just made a determination of what caused that embryonic mortality. If it's not a transfer crack, I'll go ahead and finish breaking the egg open, and I'll remove the embryo from the shell, and I'll generally just make an observation to determine if it is an anomaly chick. And I'll explain a little bit more about that here in a few slides. But I recognize that anomaly commonly is driven by overheating in the very early stages of embryonic of incubation. And so because that occurred so early, and meaning if it has an exposed brain or twisted beak or multiple limbs or exposed viscera, from that perspective, that really, the overheating early is what drove the death of that embryo. So again, I stop at the anomaly category at that point. I document it, discard it, and then move on to the next egg. If it's not a transfer and it's not an anomaly, then I just make sure that the positioning of the chick was correct, head under the right wing fully, and if that looks good, then I move on. At that point, if it's alive and it had pipped, then obviously it's a live pip. But by true definition of a live pip now, we recognize that it wasn't cracked at transfer, it's perfectly healthy because it's not an anomaly, and it's positioned correctly. At that point, if it's still alive and it has pipped, then I can feel comfortable about documenting it as a live pip, and same for a dead pip. So if I follow this procedure, it helps me make determinations of what drove my percentages of late dead, and now I can go look into how to fix that problem. So here's a sample sheet of a breakout, pretty recent, obviously from April. If you look at this particular sample, first thing I want to point out is down here in my notes section, the actual hatch from this flock, because I asked for it and we documented it, was an 81.43. And look at the residue hatch. It's an 81.52. So what that tells me is that this is a good sample. The fact that we selected these 4 baskets And we broke these 4 baskets out, and the fact that the residue hatch calculated from this data was extremely close to the actual hatch tells me that this is good data. And so if I look at the rest of my notes, I documented that the anomaly chicks had mostly exposed viscera, and a few brains. Malpositions were head over wing, and most had pipped. Now, when you recognize that I documented that most had pipped, if you look at the subcategory, you don't see any chicks documented as a live pip, and only 2 as dead pips. But look at the malpositioning category. So what I recognize is the biggest piece of this 19 to 21 are my late deads. There was 4.55%, 30 of these eggs actually fell into this category. There's also 19 of them that were in the 15 to 18 category, but look at the malposition in the bottom subcategory. So in troubleshooting this particular flock, this kind of gave me a direction and told me where to go look, at least initially. So when I look at a picture or an image of a malpositioned chick, this is the most common image that you'll see, where the chick has its entire head and beak and head completely over the right wing. The right wing is completely buried under. Now, what's pretty common, if you remember on the sheet, I documented that they had pipped, and it's very common for a malpositioned chick in this particular condition to physically be capable of pipping. What you'll recognize is that it'll be a very high pip line because its beak is more positioned to pip at an upward angle, but the chick has a lot of difficulty in trying to get completely out of the shell. And so once it makes its first external pip, now the moisture of the chick has been exposed to the condition in the hatcher cabinet. The chick will start to dry out, oftentimes will essentially just get to a point where it cannot turn its body any longer, and it can't continue pipping simply because it's over dried, or it's dried out now and it's taken too long to pip out because it doesn't have a leverage since its head's not trapped underneath the wing, it's on top of the wing. So when I went through the troubleshooting steps with this one, first thing I looked at is it a continuing pattern. And review of other flocks that hatched that day indicated it was a pattern with all flocks. We know from experience that the high late deads that are documented as malpositioned chick is commonly caused by either excessive heat or overcooling during transfer, and oftentimes rough handling as well. So we knew that we needed to review all of those items. So what can cause that overheating or overcooling? Obviously, incubator temperature set points in the last stages prior to transfer. The transfer process itself. So we reviewed that, and then hatcher set points in the first stages following transfer. The last thing we want to do is heat our hatcher up above a point of what the last stage in an incubator was. So we reviewed those items and we also looked in Maestro, and it indicated while the incubator was able to maintain settings of the stage program, it simply was running a very high temp and a very high humidity in the last stages just prior to transfer. And then in this particular case, this was a single stage hatchery. So the combination of those two provides a pretty hot environment. So could be a cause of some of the problems. In review of the transfer process, we discovered the incubators, and these are single stage, were just simply being turned off at the time that the door was opened and the first trolley was removed. And the machine would just stay open and completely turned off during that time period. And of course, this can cause some problems. We also discovered that during transfer, that when a machine was turned off, all the trolleys removed, and then the next machine was turned off before they started taking trolleys out of there. So we were seeing as many as 12 incubators in the transfer room at any one time. And what this was causing, and we measured some eggshell surface temperatures, but the eggs were just getting way overcooled during transfer because of that particular procedure. So we simply followed those steps. We dropped stage program temperature and the humidity during the last stages. In addition, we modified the transfer process to keep once they open an incubator and remove the trolley, they close the door back, allowing the machine to continue to run, and to try to minimize the number of trolleys that were going to be in the transfer room at any one time. And all of these minor changes made a huge improvement for that specific hatchery because it was a process that they were doing throughout. When we continue forward and look at some other common problems, anomaly, which is a marked deviation from the normal standard, I see a lot of hatcheries really don't document this. And again, this is one of those things that will create a high number of late dead embryo. And without identifying the anomaly, we may try to fix late stage problems and not recognize that maybe overheating in the very early stages of incubation is really what's causing the problem. So by identifying the anomaly or beginning to look for that, it helps us fix even other problems before we have the late deads. So an exposed brain is very common with an anomaly. You'll see that with like in this illustration, exposed intestines or exposed viscera, an open abdomen cavity, multiple limbs is fairly common, incomplete development of feet and toes, missing eyes, twisted beak. Those are all items that are associated around anomaly. So anomalies are generally produced from that early, heat in the first 6 days of incubation. And so what we recognize is that anomaly chicks typically have trouble getting into correct position for pipping and often get documented as either a malposition, and a lot of times they'll pip and they may still be alive or they may be a dead pip. But again, if we document it as a malposition or a live pip or a dead pip, I'm going to start trying to troubleshoot my problem maybe in the wrong area, where by not documenting the anomaly. So again, it's a pretty common problem that I see when we go into hatcheries and review residue breakout procedures. And remember, for us, at the end of the day, correct identification eliminates just chasing the wrong problem. And so when you develop your residue breakout program and your procedures and your documenting sheet, and you understand why you're doing the residue and how far you want to carry that for troubleshooting, that's hopefully what you gain some knowledge on today. And again, it's not as simple as it sounds when we do a presentation like this, but it's good to understand the basics, and it's good to work on trying to get better with your program. So that's pretty much it. At this point, we can take a couple of questions. We got just a little bit of time.
Great. Yeah, thanks, Chad. We do have a couple of questions that have come in. The first one is it advisable to do an ovo vaccine with eggs having long storage period? This person says that they commonly observe a not uniform hatch. So do you advise this?
Well, it is fairly common when you see long storage times where, especially if you're not able to control moisture in your egg room and your air cell gets a little bit bigger, and it does affect the growth of the embryo and hatchability from that perspective. But, at the end of the day, you have to decide the importance of what you're doing and what you're vaccinating with during an ovo, and that has to be your number one decision, and whether you continue with your an ovo or not, and that's really the importance of it.
Okay, great. The next question we have is, what are common causes of early embryonic deaths between days 1 through 3? And how will you determine if it's farm related or hatchery related embryonic deaths?
And that's a great question, and that's really the reason that pretty much any good residue breakout sheet should have that 1 to 3 day category in there, because it does help make that decision of, was it hatchery related, or was it egg handling related, or was it farm related? So when we look at categories of 1 to 3 and what drives that, the most common thing that we see is poor egg handling at the farm. In other words, not gathering eggs often enough in the farm. So the hen's body temperature is 105 and it lays the egg. And then if that egg is not cooled down properly, then you'll see a continuation of cell development around that blastodisc. And if you get extended to the point of too much cell development, you've got a too much early incubation that has started, and that will commonly lead to a higher incidence of early deads of the 1 to 3s, high contamination, like you'll see commonly with older hen flocks and thinner shell and shells that are that have more porosity, that or have maybe even higher exposure to bacteria because of nesting conditions, belt conditions, things of that nature can also lead to that. But common right now, and this is a little bit of a theme we're seeing, is a lot of hatcheries have had to cut back on production because the processing facilities aren't capable of slaughtering that large of a volume of birds. And so we see long storage times. And once eggs are stored from the time they're laid to the time they're incubated, once they get out past day 6 or day 7 of storage time, you'll see an increase in that early dead again. And that's mainly due to the fact that you've had too much cell death around the blastodisc itself. There's both of the big primary breeder companies today in the broiler industry have a lot of details associated around how to run a Spidey's type program or short periods of incubation during egg storage. I've had a lot of requests for information for that here lately, and so that's something that can help alleviate that problem. But generally with those early deads, we see it more associated around storage time, poor storage conditions, poor gathering at the farm. And then if it is something you're seeing more on the late 3 into day 4 type category, a lot of times it can be associated around how long it takes your incubator to warm up. So if you make your egg set and your eggs are taking an extended period of time coming up to temperature, it's just not getting enough heat to drive tissue growth, and you'll have that higher incidence of early deads with that as well. Good question.
Great. Is there any comparison between leg weakness and DOC and storage of HE?
There is. I know there are probably a dozen different studies out there that have been done that pull that comparison in, and a lot of times when you look at the early tissue development, and you recognize when we were going through the day of embryonic development and looking at the video, how early that you have tail bud and leg and wing development that occur. And so if you lack tissue development or you lack cell growth around the blastodisc early, a lot of times it weakens that tissue development, and therefore you'll see with long storage times and maybe even some poor incubation conditions, it will lend itself to that poor tissue development early on, and later on becomes an issue when it comes to leg health with day-old chicks.
Okay, great. The next question is, what is the optimum hatch window to reduce dehydration for early hatched and also to reduce poor hatchability for late hatch.
Yeah, so in a perfect world where we have optimum incubation conditions, we put ourselves in a situation where we start to see peak pipping, and generally for troubleshooting purposes, that's why I always recommend making sure we got a wet bulb and a hatcher machine, is because looking at that on a graph lets me identify when my humidity peaked in the hatcher machine. And I want to see that peak. I really don't want to see that be any below, say, 14 or 15 hours prior to pull, but I don't want to see that peak occur anything out further than, say, 20 hours prior to pull. So in a uniform incubator environment where I can manage my set time, my warm-up time, then what I'm going to see is a pretty tight window from beginning to end is all going to happen in about a 24-hour period of time, with that peak occurring between that, say, 14 to about a 20-hour window prior to pull. And if that's what my humidity graph on my hatcher looks like, it tells me that from the time the early chicks came off to the last chicks came out, then I'm going to see a pretty good spike and a peak in that humidity, and then it's going to be a fairly sharp downward curve following that as well, indicating that I didn't have any late stragglers or chicks that come off late. Especially if I'm doing my residue and I'm not seeing any live pips, I can push that window of where my peak occurs closer to my pull time, and that just is an indicator that your uniformity is very good.
Okay, great. And I think we've got time for one more question. What are the common causes of early embryonic deaths between day 1 and 3? Oh, sorry, we already answered that one. My bad. Does the malposition, does the malposition of the head above the wing hurt the hatchability when using Enovo?
Well, you have to recognize that it potentially does, simply because if the chick gets malpositioned and it essentially puts its head more up in a direct path, or in a situation where it could essentially be in the way of the needle itself as the punch comes through the egg and the needle comes in there, I would have to believe that yes, that would increase that incidence. Although if you see a high incidence of the malposition essentially will be what drives your embryonic mortality, as opposed to, say, a needle hit in a bad place on the chick itself.
Okay. Well, thank you, Chad. This has been just a great webinar, lots of great information, and thank you to everybody that has joined us today. Please know that the presentation and slides will be available through our website, www.chickmaster.com, in the coming days, and we will send out a notification with that to let you know when those are posted. And any of the questions that we received and that we did not get a chance to get to, please know that we'll either have a hatchery specialist reach out to you, or we will go ahead and answer those directly to you. So thank you again, everybody. It's been a great day, and enjoy the rest of your days and evenings.
Thank you, everyone.